Hello, we're ParaMetric, and we are the first to make core body temperature measurement accurate and non-invasive for emergency medical services. Imagine you've just been in an accident. When EMTs arrive on scene, they check you for your ABCs, that is, your airway, breathing, and circulation. However, they don't check your core body temperature. Core body temperature is often considered the fourth vital sign. It's the temperature of your internal organs and the temperature of the blood at your core. It's a metric that is used by both EMTs and hospital emergency medicine providers to make treatment decisions for patients through assessments of thermoregulatory disorders, trauma, and pathological conditions. It's critical that changing core body temperatures be addressed quickly, otherwise, patients risk worse downstream health outcomes. Changing core body temperature can be caused by blood loss and trauma, cold and heat exposure, and sepsis. In fact, there are 4.3 million annual EMS cases involving accidental hypothermia and hyperthermia. Changing core body temperature can cause the lethal triad, which is very dangerous for trauma patients, arrhythmia, and increased hospital stays, leading to up to $15.5 billion in annual healthcare costs.
And so you might be wondering, why aren't EMTs actually checking their core body temperature of their patients? Two of the most common modes of equipment measurements that are available for EMTs are esophageal probes and tympanic thermometers. But the issue is things like the esophageal probe are overly invasive and hard to easily implement into clinical workflows. And the tympanic thermometer actually isn't giving you an accurate core temperature measurement, but rather a proxy measurement, which isn't able to actually capture the information needed for diagnosis and treatment. And so when you look at the competitive landscape, there aren't actually any solutions being implemented in EMS right now that are both non-invasive and accurate. And this is a well-recognized yet unsolved need. And so we developed the ParaMetric sensor. How it works is it is a sensor that uses heat flux principles and control algorithms to actually bring the core temperature up to the surface of the skin for measurement. It does this by taking measurements behind the ear or on the patient's forehead. And there are two components. There's a reusable sensor component and that takes core temperature measurements, and a disposable sticky pad that attaches onto the patient's skin and will mount onto the site of measurement. And at the current moment, we are in the early prototyping and benchtop testing phase. But what we have found is that our solution is going to be able to be completely non-invasive, being placed just on the skin. It's going to be accurate, providing core temperature measurements and not proxy measurements, and will be seamlessly integrated just given the nature of its lightweight, low cost, and reusability, which would make it very appealing, especially for EMS department budgets and their protocols and workflows.
With those two components, our venture mainly follows a reverse razor and blade model. We plan to sell the units of our reversible sensor devices at a relatively high margin, along with necessary disposable pad units at a relatively low margin. Unlike hospitals, EMS departments do not bill for individual products and services, with very limited exceptions. Therefore, it is most appropriate that the reusable component makes up the primary source of revenue, and the disposable component is set at a lower price. Although the end users of our device will be the EMS providers that are directly interacting with the patients prior to reaching the hospital, our target customers are the purchasing offices or executive boards of EMS departments, who are responsible for making decisions about new and recurring equipment purchases. Moving on to our market, the global patient temperature monitoring market was valued at $3.74 billion in 2023 and is expected to expand to $7.29 billion in 2033 with an estimated growth rate of 6.9%. Within this sphere, our service addressable market consists of US EMS departments with basic life support or advanced life support services that use continuous core body temperature monitoring solutions. With 2,300 licensed US EMS agencies, 88,000 EMS dispatch vehicles, 40 million annual emergency calls, and our reusable and disposable product costs, We estimate this market to be around $208 million. We plan to target our marketing to suburban and rural EMS departments whose patient transport times are longer and thus have a greater need for continuous core to body temperature measurement. Given that approximately 73% of EMS departments serve suburban and rural Americans, with our estimated penetration rate of 10%, we estimate a serviceable, obtainable market of around $15.2 million. After our feasibility testing and product development back in 2022 to 2023, our next steps are going to more customer discovery and product demos in the Washington, D.C., Baltimore area, as well as conducting our phase 1 and phase 2 clinical trials at the Johns Hopkins Medical Institute. After we finalize our design concept and raise the requisite capital and also manufacture our production equivalent sensors, we plan to prepare our FDA 510(k) submission. To work towards this goal, our goal of non-dilutive funding for the 2024 to 2025 year is $20,000. The majority of that will be going to our prototyping and manufacturing services, with around 1,000 dedicated to our clinical study and 60 dedicated to filing our USPTO provisional patent application. We are a dedicated team of 3 biomedical engineering undergraduates and 3 passionate EMS and medical device professionals. We're ParaMetric. Join us in being the first to create core body temperature measurement that is accurate and non-invasive for EMTs.